Those that have joined today, I do believe that you are very curious about the path or the road to becoming a pediatric surgeon. For myself personally, I've never spoken to a pediatric surgeon. I've heard of pediatric surgery. I still don't know the difference between a general surgeon who also treats pediatric cases and also like a specialized pediatric surgeon. But I think by the end of the session, we'll all have a good idea so that you can set yourself on a path to becoming one of the pediatric surgeons in South Africa, because I'm sure we do need more of you guys. Doc, welcome, and I'll hand over to you. Right at the end, feel free, we will give you time to ask all of your questions and answer anything that you would want Dr. Mashaba to address. So now I'll hand over to Dr. Mashaba.
So again, thank you for the invite. I will try and share my presentation. Let me know if you can see it. I appreciate this opportunity to share the journey, a very difficult but yet beautiful journey. So the outline of the talk, we will talk a little bit about who I am, and then we will get into details about what is pediatric surgery, why choose pediatric surgery. So we'll learn more about why choose pediatric surgery, the journey to becoming a pediatric surgeon, the challenges that are on this journey. I will share a little bit of the tips that helped me through the journey and the rewards of the specialty and also career opportunities. So I think from the first slide, it was clear that I am very much I'm very much Tsonga. So you can see on this picture that I put here, this is exactly who I am. This picture I found on the internet and it just resonated with me. These women are the people who made me. They raised me, and exactly this environment is where I was born and raised at Mudabula village around Malamlele in the province of Limpopo. So one day I went back to the village and I was driving the streets I was walking as a child, and I decided to go and visit my preschool. And you can see this building hasn't changed much from how it was back then. That white paint you see, there's actually a blue paint that just got worn out. I mean, no one stays there anymore, but this four-roomed house is where I started my schooling, and it hasn't changed much. Of course, it's not as clean as it was back then, but then it was here where the journey began. And then primary school, again in the same village. This primary school is known as Twananani Primary School. So this is where I then moved from the creche and I came to the school. And then later on, I moved to Guyane High School. This is the place that made me. This is the place that shaped me. This is the place that made me who I am. The resilience and everything that I am today comes from this school. So as it is today, I am a mother of two vibrant boys. I am a wife to my supportive husband, who is also a pediatric surgeon. I hold an MBCHB from the University of the Free State. I have a master's in pediatric surgery from Wits, and I am a fellow in the College of Pediatric Surgeons. Just to name a few of the work that I've done, these are some of the publications that are under my name, the biggest one being the one from the International Cancer Report Journal, and then some from Annals of Clinical Case Reports and also SAMJ. So what is pediatric surgery? This is a specialized field that focuses on diagnosing, treating, and operating neonates, infants, children, and adolescents. And it's very important for me to mention diagnosis and also management before I go into operating, because as a surgeon, it's important to know how to diagnose, how to manage before you decide when to cut. Because it's not always that we go and cut. It's important to know when to not cut and when to cut. So in terms of age, it depends where you work across the country. So we start from day 0 of life up until 13. That's in my department. And actually, when I say day 0, there is actually fetal surgery that in the country it's done in the KZN at the moment, but we can, as pediatric surgeons, also operate before birth when the children are still in utero. So when we deal with the age, in our department or in my department, we go up until 13, mainly because our pediatric ward doesn't take anyone that is above 13. But if you go to Charlotte Maxeke and Bara, they will take children and teenagers up until 16 years of age. And other departments, they differ. Others go up until 10, but we can go up until 16. And then when it comes to oncology, we go up until 18 years of age. Pediatric surgeons, there's nothing that we don't operate from head to toe, except the brain, the bones, and the heart. Anything surgical that a child needs. I usually tell people when they say, do you operate on this? And then I say, anything child surgical, I am for that. Except if it's the brain, bones, and also heart. We go from mouth to neck to chest, lungs, abdomen, pelvis, soft tissue, urogenital, gynae, everything. That's what we do. Why does it matter that there are pediatric surgeons? And the answer is children are not small adults. They have a very unique anatomy and also physiology. So it's important that we have general surgeons for adults and also pediatric surgeons, because we as pediatric surgeons, we understand the physiology and the anatomy of the small ones. We also understand that everything we prescribe has to be tailored for each patient. That's why even the fluids and also medication has to be per kg. So you have to have people that deal with that every day so that you don't have overdosing. Also, a hernia in an adult and a hernia in a child are very different, and they've got very different management. The cost of the hernia in children as compared to adults is also very different. So if we don't have pediatric surgeons, we'll have people who operate on children and do what they're supposed to do in adults, and it's not the right practice. Also, the impact of surgery extends across a child's lifetime. I always say it's a vital cut. It's a lifeline cut. When you operate on a day 0 of life, you give that child 80 years more to live as compared to operating on an 80-year-old who's lived 80 years. So it's a cut for life. You give that day 0 of life a lifeline. So I don't know any other person who wouldn't want to be part of that. So the pathway to becoming a pediatric surgeon, of course, you have to complete your MBCHB, your internship, and your community service. And then you become a medical officer. Then you have to become a registrar for 5 years. And then you do your ped surgery final exams, and then you register as a pediatric surgeon. That's the overview of the pathway. We won't go into internship and also community service. We'll start talking from medical officer. Of course, the market is not the same. Back then, we just gave the department 3 names and say we want to go to these hospitals, and they chose one. There was no interview. You didn't have to have done anything, intermediates, ATLS, nothing. All you needed to be was a doctor, and then they would give you a post, and that would be a permanent post. At this point, today is very difficult. I see many medical officers in my department who are very worthy of getting posts. They are struggling. So things are no longer the same. But when you get to medical officer point, you need to apply to surgical departments just to strengthen your surgical experience. It doesn't have to be pediatric surgery, it can be general surgery, because the principles of surgery are the same. The principle of resuscitating patients, stabilizing patients, handling of tissues, and understanding how laparoscopy works and all those things. You need to be in a surgical department. You can't be in maybe psychiatry or any other place. You need to strengthen your experience. Exposure to pediatric surgical cases will give you also an advantage. You don't have to be, but if you get exposed to children, it's also an advantage. Building relationships and mentors and supervisors, having mentors and building relationship with supervisors is very important. This goes for people who are interns and also com serves and all that. Being reliable on the ground will go a long way, because those supervisors are the same people who are going to write letters of motivation for you, and they're going to be your references. So you don't wait until you need a reg post for you to be reliable. These people that you work with, they know a lot of people, so showing that they can count and rely on you very early will also give you an advantage. I am very cognizant and understand that people who work in the rural areas, they do not have the same opportunities as other people that are in urban areas, because most of the ICUs in rural areas are not accredited to training. So you'd find that it's very difficult for other people to apply for certain exams, like intermediates, for example, because they don't have that ICU rotation. So what happened with me, because where I was as a medical officer in Polokwane, it was not, we did have an ICU, but it was not accredited and not recognized by HPCSA. So what I did, I spoke to the clinical manager and my supervisor at the time and asked them to send me to Charlotte Mateke for trauma rotation and ICU rotation. So if it's possible for you to talk to your colleagues and your supervisors and clinical managers to send you to places where you can rotate for 3 months, 4 months, for you to get that letter that allows you to write intermediates, please do so, because it is possible, as long as the department allows you to do that. Because what happens is people end up spending 4 years, 3 years waiting for a post in institutions that have ICU that's accredited. And the competition is too high. You will find that you don't manage to get into those institutions. So prepare where you are and try to ask your hospital to help you. ATLS, don't wait until you are pressured for intermediates to do ATLS. Just do it when you get time, because the dates of ATLS are also a problem these days. Primaries, try to do your primaries post your internship. I've spoken a lot about intermediates and how to get your papers to do intermediates. Pediatric surgery departments in South Africa. Not every province, unfortunately, has got a pediatric surgery department. We have here in Polokwane for Limpopo, we are the only department that's serving the whole province. So our scope is huge. We have lots of patients, we have lots of operating time. We see lots of amazing things, we do amazing things, we've got an amazing team. So you can join us if you need to. Johannesburg, which is where I trained, amazing institution. I wouldn't have chosen any other. This is Bara Charlotte Maxeke and Nelson Mandela Children's Hospital. Pretoria, they also have Pietermaritzburg. At the moment, in terms of minimal invasive surgery in pediatric surgery, this department, to me, tops every other department, followed by SMU in terms of minimal invasive surgery. They do very good work there. Nelspruit is the baby in the country. It's about 3 years old. There's 2 pediatric surgeons there, so they're a growing department. Durban, Albert Lutuli, East London, Tata, Cape Town, and also Bloemfontein. They have departments there. In terms of training, not all of the ones I've mentioned are accredited to training. We fortunately have got 4 registrar posts, 2 of which are filled for now. We are looking for 2 more. So at the end, you can ask me an email where you can email your CVs so that you can get into the system. Johannesburg, and that is VETS, is accredited. Pretoria, it's SMU and University of Pretoria. UKZN is Durban and Maritzburg, and East London, Walter Sisulu University. Cape Town is UCT, Stellenbosch, and also Bloemfontein, University of the Free State. The requirements differ from department or institution to institution. I know departments that will not give you a reg post if you do not have intermediates, but that's not across the country. There are some institutions that take people with just primaries, and also in those departments that don't take people without intermediates. They do take other people, maybe supernumeraries. For example, if people from Namibia are sent by their countries to come train, even without intermediates, they'll take them and they will do their intermediates within the 5-year rotation. So if, don't be afraid to apply to different departments. You might find that you actually apply to a department that can take you even with your primaries. I know of someone who has taken post-ComServe, but it's not actually, it's unusual, but it has happened before. The posts are very limited and the competition is just way too high. So just position yourself and make sure that you've got things that will, make your application a little bit different from others. Primaries are a given. You do have to have your primaries. And we've spoken about intermediates, ATLS. I know of a post that there were 2 posts and there were over 300 people who applied for those 2 posts. So what will set you apart is research. At this point, there's a lot of people with intermediates, ATLS, and then now they go on to research. They want to see who has done research before. So wherever you are, whether you're an intern or a ComServe, if you hear your seniors say, this is rare, we've never seen this before, take that case and write a case report on it. Case report takes 1 day to write. You only need 5 articles as a reference, and it can be 2 or 3 pages long. It's not that bad. It's not too much work. So don't wait until you're a registrar to do research, because that research paper might be what sets you apart and gets you a reg post. Becoming a pediatric surgeon, this is from the CMSA website. When you go there, you just click on the colleges and then you choose the College of Pediatric Surgeons. You will see there, they'll tell you everything that they need. They need you to do your primaries, post-internship. You can only write primaries after internship. And then your intermediates, they're very strict there. You should have spent 12 months in general surgery. And from those 12 months, 6 months must be general surgery, 3 months ICU, 3 months trauma. And again, pediatric surgery is 5 years, which is 60 months. They will not allow you to write before you finish 48 months in a registrar post. They do not care whether you've been an MO in pediatric surgery somewhere, and then they don't do that. Whether you were an MO first and then a registrar after 4 years, they will still count from registrar time. So you need 48 months of being a registrar before you can write. I know some colleges say 36 months, some claim they can even write after 18 months, but with pediatric surgery, they're very clear about 48 months. You can see in this slide, you have to not have served less than 48 months for you to write your final exams. And then after writing, after 48 months, you still have to finish the other 12 months of your training before you can register with HPCSA. HPCSA will not allow you to register even after passing your exams if it's not 2 weeks before your 60 months ends. So yeah, 60 months. And then challenges on the journey. Again, limited training posts and high competition. For some reason, we do a lot as pediatric surgeons, but we are not allocated enough posts as compared to general surgery, for example. For example, in our department, we are the only ones serving the whole province, but we only get very few people that are allocated to our department. Somehow, pediatric surgery is still seen as a subspecialty when we are actually not a subspecialty. So we are still fighting to be recognized properly and given proper staffing. The work is intense. The workload is intense. The hours are very long. I remember during training, I would leave home at 5:15. Actually, we would start work between 5:15 and 6 every day for all those years, and then get home 6:30 to 7. Sometimes you'd be on call the whole weekend at Bara. You leave home at 5 in the morning, and then you only come back home 6:30 on Monday. There's no post call, there's no pre call. Those kind of things happen in nicer departments like anesthesia and all that. But with us, there isn't such. Emotional toll in dealing with the workload and the intense long hours, but also we're dealing with delicate small kids who are very sick. So a lot of times, it takes a toll on us. Balancing professional and personal life, there's a lot of people who talk about this. I just want to say to you guys, there's no such a thing. I think when you go into a registrar post, you must just know that for that 5 years, your life basically stops, to be honest, and I'm being honest with you. It stops and you must be okay with it. You must be okay with not being able to attend funerals or parties or weddings or going on, ladies' trips and all. You must be okay with telling people you are not going to be able to. The life of people around you is going to continue, but yours for those 5 years, unfortunately, it won't be the same. You won't be the super mom that you used to be, or super dad, or the super wife, or child, or brother, or sister, or everything like that. And it starts with understanding that it won't be the same, because the moment you try to be everything, you're going to crumble. It's going to be way too much for you and you're going to crumble. You just have to pray to God that you have understanding people in your life that understand that for those 5 years, you are just one person. You can't be the best registrar, best mom, best wife, best dad, best husband, best child, best friend, everything at once. You are just one person. So you just hopefully pray for relationships that are strong, and also for people who will be understanding, and for people who will support you, the people who will understand that the journey is long and it's difficult. It's blood, sweat, and tears, and they won't add on to that stress, and they will try to help you, because pediatric surgery alone is very difficult. So you don't also want any other stress. So hopefully God blesses you with those kind of relationships where you have people to carry you, because you will need them in your life. I've said so many things, but what's mostly important, whether it's difficult, it's blood, sweat, and tears, what's mostly important is that it is possible. Whether it's hard, whether it is possible. As hard as it is possible. You just need to know why you started, and with the challenges you can bend, but you must never break. You must be teachable. Wherever you go, I know there are a lot of people who are in institutions where they are operating, they know how to do an appendectomy, they know how to do this and this and that. When you get to your training post, be teachable. Let someone say, okay, Charmaine, let me teach you how to do this? And then you say, yes, please show me. Let them show you. And then when it's your chance to operate, then you operate. Don't have the attitude of I know, because then people will leave you to your own device. They will see that you're not teachable, you are not receptive to teaching, and then they'll just leave you to everything. And mostly just to show you that you don't know, because honestly, before you enter rest time, you don't know. So allow and let people to teach you. It's okay for consultants to ask you a question and you don't know. You will not know a lot of the things that they will ask you. And up until when you are final year, even when you've written your exams and they still ask you a question, you still won't know. So it's okay in a reward round for them to ask you something. You say, Ish, that's a good question. I will go and check. And then you go home and you check. Because when you stand outside Bara, it's written Chris Hani Baragwanath Academic Hospital. And that academic is in big letters, because there's no point in us going into Chris Hani Baragwanath knowing we are there to learn. So there's a reason why it's called an academic institution. It's for teaching. Just make sure that you don't get caught and be asked one question many times and you still don't know. So it means you're not teachable and you're not learning, you're not studying. So if they make a mistake of asking you the same question the second time, you just need to kill it. There are days where you are going to be a great registrar, but on that day, it means you are going to be a bad husband, mom, wife, etc., dad. Because when you put in work at work, it means you are missing out something at home. You have to be able to be okay with it. Because if you have mom guilt, dad guilt, wife guilt, husband guilt, you will not make it. You have to be okay with saying, today I was good at work. And of course, then I missed bedtime. You have to be okay with it. And then there are days where you're going to be a bad registrar, because you were a great mom on that day, you were a great dad, you were a great wife or a husband. You have to be okay with people at work saying, no, Charmaine, didn't do this, what, as long as it's not something that's going to kill a patient. But there are days where I had to choose to be a great mom and become a bad registrar. And there are days where I was a great registrar at work. They were praising me, but then I knew that I didn't attend a school meeting. And I had to be okay with that, because I'm just one person. There's nothing I can do. Tips, please seek mentorship early. There's a lot of us who are happy to mentor. get involved in surgical societies and research, attend conferences and workshops. A week ago, there was a great conference registrar, pediatric surgery conference that was organized by SMU, and even medical officers are allowed to attend. That conference happens every year. So go there, meet people, know who's the who's of pediatric surgery, know how things are done. Just, meet people and get connections and all that. Maintain empathy every day and be resilient. Never stop learning because pediatric surgery it actually evolves rapidly. So once you are done, the rewards of being a pediatric surgeon, you actually just live your dream. It's deeply fulfilling. I used to be told when I was a registrar, people say it's such an anticlimax. Now you have your FC, and you don't know what to do. You're like, is that it? They're actually lying. It's the best thing you can do for yourself. Literally, the best thing. It's like everything just makes sense. So it's not true that you get to the top and you realize you don't know why you even did this thing. You get opportunities for research and teaching, you can collaborate, and also it's a lifelong learning opportunity. You can become a consultant in public and also do your private practice. In Bara, at this moment, they are the only ones who are doing subspecialty. I know there are other institutions that are coming up with a lot of exciting things, but then they're doing subspecialty in oncology, colorectal, urology, neonatal, all those things. So there are opportunities like that, and also you can also become a global health specialist. So just to conclude, that children are not things to be molded, but people to be unfolded. The journey again is long, but very rewarding. Every step shapes you into not just being a surgeon, but a healer for the future generations. So this is me. I am part of Pediatric and Adolescent Surgery for Africa. It's 3 of us, pediatric surgeons, me, Prof. Shifularo, and Dr. Motlowu. You can find us on, like, from this hospital, Puluso, Mediclinic Zanin, Hoedspruit Private Hospital, and also NHC in Toyando. Thank you for your time. That is it from me.
Thank you so much for that, Dr. Mashaba. I think you can put your yes, now we can see you. I'll open the floor up for questions. If there's anyone on the floor who wants to ask a question, the chance is now before I ask.
Yeah, now my question is, I want to, because the people on the platform are doctors. When a child is sick, every doctor knows the child is a pediatrician. I've never met a doctor who sends a child to a physician, and that means a internal medicine specialist. But why would the same doctors send a child to either a general surgeon or a urologist or people who do adult surgery if they need a surgical intervention? What are your thoughts around that?
Okay, I think availability makes people understand things that they didn't understand. For example, I've realized that the more pediatric surgeons that are available to people, that's when they know what we do. Up until 2018, there were just 45 pediatric surgeons in South Africa, if I'm not mistaken about the figures. But most people actually don't know that we are pediatric gynecologists, we are pediatric urologists, we are pediatric trauma surgeons, we are pediatric everything. So they assume if it's urology, then they think of urologists because those are the people that are available. But also the fact that not every pediatric surgeon is trained to do everything. There are some institutions where they don't do urology. So you might find that maybe that GP called a pediatric surgeon who doesn't do urology and said, no, send to urology or something like that, or no, send to the gynaes. There are not many pediatric surgeons that are actually doing everything at the moment. So I think the more we have these conversations, the more people are going to understand that anything surgical that has got to do with a child can go to a pediatric surgeon. I hope I answered your question.
No, thank you.
Hi, Dr. Mashaba. Thank you for the good presentation of your journey to becoming a pediatric surgeon. I might have missed some of your slides, but anyway, I know you've worked in Petersburg before you left. I think you worked in urology, and then maybe gen surg, if I'm not wrong, before you left. When you started pediatric surgery as a registrar, did you feel like those specialties, they contributed so much towards your training in terms of like doing other procedures? Did you find them easy? Did you feel like you were just starting from the beginning because some of the things maybe you are not doing them according to the book? Yeah, so that's just my question. Thanks.
Okay, thank you, Tumelo. So I did speak about involving yourself in surgical disciplines. And I said that just for the principles of surgery in terms of resuscitating a patient, managing a patient, stabilizing a patient, tissue handling, being confident in how to cut, and just the theater environment and all those things, those principles are the same across the board of departments. So I did do urology as a medical officer, and I did do pediatric urology as well. What it helped me a lot based on the surgical principles and also the confidence of knowing I could do a laparotomy, I could do this and that and that. But when I then got into a reg post, it was a different ball game because I had to now do things by the book. Things that I could do, I thought I knew how to re-implant a ureter. But when I then started reading, and in those institutions where you train, you do step by step as the book say. So then now when I started being trained, I could see that there's a difference. But also I had also done pediatric surgery for a year or two before I went to start my reg time. But by the time I started my reg time, I had such great opportunities and teachings that by the time I got there, I could do most things. And but then also, even though I thought I could do most things, I was still teachable. I still went there and said, teach me. And then they would show me. But then I had already been taught already from where I was. So getting into the surgical disciplines is very helpful for your confidence and everything else. Tumelo, I hope I've answered.
No, thank you.
Wutlokwa has a hand.
Good evening. Again, thank you so much for such a wonderful presentation. And I think it's quite inspiring to, have a glimpse into your background and to see that it is very much possible, especially as a community service medical officer where there's such an uncertainty about your future in the current climate that we're in. I wanted to know, do you think that there's enough exposure of pediatric surgery to those who are training in undergraduate, people that may not even conceptualize that this is actually a specialty? Do you think there's enough knowledge about the profession?
Okay, so from where I did my undergrad, my first exposure of pediatric surgery, I was in 3rd year. So in the University of the Free State, you get to rotate for 2 weeks in pediatric surgery in your 3rd year, 2 weeks in your 4th year, 2 weeks in your final year. So what caught my eye, or the day I realized I wanted to be a pediatric surgeon, I was actually thinking about it today. It was like a 5-year-old girl with a stoma from Lesotho. She was wearing like a pink hospital gown, and I still remember that that was my first exposure. I was in 3rd year. I understand that it's not the case for every institution, and some people actually even qualify without ever going to a pediatric surgery ward. And so mostly the people I've met, they do not actually have enough experience. I know at vets, they come, we give them tutorials, but I don't really see them much in the ward. Maybe the clinic now and then, but I think what I got as an undergrad, I don't know if other people are getting that. We were examined as 3rd year, we were examined 4th year, we were examined final year in pediatric surgery. In the University of Limpopo at the moment, we give them tutorials, but we also ask them to come to the ward. Last week they came for the rounds and all that. So I don't think the exposure is as much as it actually should be. We should do better.
Good evening, everyone. Good evening, Dr. Mashaba. Good evening, Dr. Ramrasi. I just wanted to say what a beautiful talk. You spoke very well. Me and my family enjoyed listening to you in the car. You were very audible, you were very understandable and very relatable. I think, like you said, as a mother, as a wife, and as a registrar, it's quite hard. And I'm glad that you were able to say all those things. Well, my whole family is listening so that they can understand. So I'm really grateful that they were able to hear it from someone else who's not just me. Yeah, thank you so much. It was nice.
Thank you, Precious. That is one of our registrars in the province. If he's still listening, Mr. Mabocha, please, hey, you have to support that woman. It's tough out there. Very, very, very. You need to be a support system. You need to be a support system. It's very hard. I have shared the Gmail on the, I've shared it there. I hope all of you can see it. So please just send everything. I just want to say, sorry, Dr. Ramrasi, before we go on, I just want to say that, guys, when you apply, sometimes you don't get called to interviews only because you don't qualify. Please give attention to that Z83 thing that you feel. Just make sure that you filled it completely. You filled it that you're male or you're female or you're not. You filled in, if something is not applicable, say not applicable. If you are working at Rob Ferreira, say currently working at Rob Ferreira, just make sure that there are no mistakes on your Z83 because you could be the most qualifying person, but the HR systems it's very difficult. So just make sure that you don't get caught out in minor things that you send. You fill in that Z83 online, and please still attach a manual one to whatever that system you guys use to apply for jobs these days. Okay, Sarafina, I see your message. Thank you. Thanks,
Yeah.
Dr. Ramos.
Yeah, thank you so much. Thank you so much for that talk. I think one sentiment that I honestly really resonated with me was when you said when you go into academia, like in academic institution, you're there to learn. You don't absolutely have to go there knowing everything. Because I think the most scary thing for most people when they enter in the program is the uncertainty, you know, or the embarrassment of not knowing something. But I think you really re-echoed or re-emphasized the fact that we are long life learners and there's no shame in not knowing, and the fact that we need to be absolutely teachable, you know, for us to get the most utility out of this training post. But I just wanted to find out, I really appreciate that you also tapped into like, what can I say? Physical preparedness in terms of your support structure when you actually go into the program. But what would be your advice to people mentally? Because I think getting into the RESH program with those intense work hours that you already highlighted, and I think some people, somebody
Apologies,
just
Dr.
said,
Ramos.
I think iPhone, your speaker is, I'm gonna mute you quickly. But yeah, what I wanted to ask is you've really helped us, especially for people who are mothers and, you know, or husband or fathers. What would be advice for us to prepare mentally so that we don't lose it while we're in the program? Because mental health is a big thing, like mental preparedness.
Okay, so for me, every time, I think even in undergrad, what has kept me going is there are two things. You've got external motivation and then you've got internal motivation. Most of the times, external motivation is the people around you that are going to motivate you and all that. But when that fails, so when they're not there anymore, or when they're tired and they get weary, what remains is the internal motivation. And in one of my slides, I did say, know why you started. So know why you want to do this. It's the only thing that will keep you going, because at some point you will be alone. I know there are siblings, there are parents, there are children, there are partners and friends who they are great, but at some point you'll find yourself walking this journey alone. And the only thing that will keep you going is that internal motivation, the thing inside you that made you start, that when you are alone, you know why you want to do this and where you want to go. So I would say keep that burning inside you and just don't give up on the thing that made you start. And that thing is usually go back to the younger you. What did you see about yourself as you were growing up? I've gone back from where I started and I've shown you the streets of where I used to walk. I've shown you my preschool, I've shown you my primary school, I've shown you my village. Basically, the girl that was walking those streets was the girl that wanted to be somewhere in life one day. And that's the only thing that will keep you going. Everything else outside is going to fail. It's going to fail you and you will be left with that thing. So for me, that's what kept me going.
Thank you so much for that. I also see your comments. Mabosh saying, thank you so much for being selfless. Your department, your family are so blessed. have you considered to be an academic? That's for you, Doc.
Oh, me. So
Yes.
unfortunately, by default, once you become a consultant, you like join staff to the university. But then also by virtue of being a consultant, you become an academic because there are juniors that you have to train, that you've got registrars already, medical officers, community service, doctors, interns, and students. So a lot of times your ward round will go from your registrars, MOs, community service interns, all that. So by virtue of the position that I hold, I am already an academic, and yeah. But to go sit at the university, and no, I will always be a surgeon who wants to cut. But yes, I will teach.
Yeah, no, thank you so much for that insightful comments and input from everyone. I'm just gonna, Mashaba, I must say we are honestly inspired. And thank you so much for taking time out of your very busy schedule to come and speak to us, to build us. I think as I was listening to you, I mean, I've learned a lot from you, and I can honestly appreciate seeing someone who's humble, who's very relatable, someone who's, what can I say, who makes the road seem easier than it seems. And I hope you are also willing to take some people in for mentorship should there be anyone on the floor who would want to have like a mentor like yourself, if that's fine, Doc.
100%. We are available. There's Dr. Mutloung here, very great mentor for people. So don't sleep on him, guys. Don't sleep on him. He's here. He's the HOD of SMU. So don't sleep on him. Just see his name and bother him there at SMU. I see also Dr. Makuba. She's a general surgeon. She joined us here. Don't sleep on her. Vibrant, young, brilliant laparoscopic colorectal surgeon. Please, please don't sleep on these people. I'm trying to check who else joined here that can mentor people. I think some people I know joined probably with names I don't know. I see the Samsung, I don't know, a Zoom user and all that. But for now, those are the people I see. So Dr. Ramrasi, please let your audience not sleep on these great people on the audience.